February is American Heart Month, and now we're learning that heart disease patients are often predisposed to problems. There's even genetic testing to assess your risk. Joining us right now is Dr. Marc Waase from White Plains Hospital. And doctor, what do we need to know about our health that maybe we don't know already?
Well, thank you for having me on today. It's a pleasure to be able to talk to you. Heart disease remains an overall #1 killer in the U.S. The big risk factors for heart disease remain lifestyle, diet, exercise, the toxins that we put into our bodies, smoking, but also family inheritance, genetics, the cards that you were dealt with by your parents. And here at White Plains Hospital, we try to identify any cardiac risk factors, including studying your genes.
When we're looking at our family members, and I'm not trying to point a finger necessarily at anyone specifically, but is there a familial side that we need to be focused on? Mothers, fathers, does that have any effect?
No, both sides. It depends. We spend a lot of time looking at your mom, your dad's side, as best as you know it, because both sides can put you at risk.
Mm-hmm. I'm sure when patients come in, because I know I run this problem a lot, they'll say, okay, give me your family history on a topic. And I sit there and go, I don't always know. How do you start that conversation? What questions should we be asking our parents about not only themselves, but their parents? What information should we bring with us to you?
That's a great question, and something that I often recommend patients come, be prepared when you come talk to your doctor. One of the things that you want to talk to before you even see me is to talk to your primary care doctor. Oftentimes we can talk about your parents and your siblings, your aunts, your uncles, your grandparents, and asking questions such as, why did they die? What did they ever pass out? Did they ever have a heart attack? These are interesting questions that help prepare you for your conversation with your doctor.
Yeah, and listen, it's not always the most pleasant conversation. Hey, mom and dad, tell me about this bad history, but it's history that's important for us moving forward. Dr. Waase, thank you so much for the time this morning and during this important Heart Health Month.
Because we got to keep celebrating more and more birthdays too, right, Tara?